A hearty good afternoon and welcome to the session of Male Fertility. We are glad to have Dr. Swati Shree among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Okay, thank you. Hello all. I'm Dr. Swati, consultant Apollo Fertility. So, today we are going to discuss the topic male infertility. So, coming to infertility, still this is a common but incorrect belief that infertility is a woman's problem. But there are in many cases, like we have found that in out of one in five infertile couple, the problem lies solely on the in males, and also in uh, out of four, one infertile couple will have the problems in which the problems lie in both males and females. And also in one out of seven, we do not find any problems. So the male partner also plays a significant role in fertility. So what is male infertility? So first of all, infertility is a problem when the two couple are trying to conceive since 1 year with having unprotected intercourse and regular intercourse, and they are not having any problem with that. So in that is called infertility. So when there is infertility and we investigate the couple, and if we find any problem, and then it is called the cause of the problem is called infertility. So if the problem lies mostly in the males, then it is called male infertility. So coming to what is male infertility in particular. So, mostly to diagnose male infertility, the most important parameter for which we rely is semen analysis. So, semen analysis is a test of the semen which is done by testing the semen under microscope to look for the sperms. These are the sperms are the main the gametes which are going to meet the eggs to form the embryo which is going to form a baby. So the sperms are examined under microscope to look for their number, to look for their shape, and also to look for their movement, how they move. So that are forms the important part of this semen analysis. So once they are these analysis is done, the lab it is tested, and then it is compared to the reference guideline which is given by WHO. So as per guideline, we say that the sperm count is less, or the sperm movement is less, or sperm's shape is not proper. So in this way, it is judged. Another problem, coming to male infertility, so there can be problems with these, any of these, then only we can say that there is male infertility. So male infertility can be categorized like there can be problems with sperm production. So in that case, there will be either low of the very low sperm count, or there will be no sperms in the semen, or there can be the sperm count can be normal, but their quality will not be very normal. So what means by quality? So the quality is the ability to move, because once the semen enters the female genital tract, it has to swim up to reach to eggs. So the capacity to move forward is very important for the sperms. So if they are not able to move, or we compare that in percentage. So when the 100 sperms are examined, how many sperms are moving properly forward? So that is what it is checked. So if it is not meeting the criteria, the movement, it is called the movement of problems with movement. Sometimes this everything is fine, but when we examine the sperms, and when they are examining the sperms for this, or every sperm has a part of head, cap, neck, and tail. So when they are examining the sperms, they look for all the parts. So at least if we are examining 100 sperms, at least four of these sperms, if they are having all the parts, it is called the normal morphology or normal shape of the sperms. So it is also important to have normal shape. So these are the important criteria which is checked for the semen analysis. And so there can be either problem with the sperm production, or there can be also the problem with the sperm transport. That is, the sperm is getting formed, but it is not being able to carry it to the outside. So sperm formation happens in testes, and through the reproductive tract, it is transferred. So if there is any blockage in the tract, or if any problem in the tract, so it cannot be transferred. So that can be one of the problems. Other common problem can be either the sexual problems. So there can be the males can have the problems of erection or ejaculation. These also are the sexual problems. So one by one, I will discuss how we diagnose the problems and how we treat them. So coming to the sperm formation, the problems with the sperm production. So this production problems can be, there can be many reasons. So when there is, we find that there is low sperm counts. So then we see how much low it is, and we also try to find out the causes. So whenever you go or meet a fertility specialist, your specialist will ask you a series of questions. So these series of questions actually help us to find the any cause which can be leading to the infertility. First of all, like your age. Age matters because with age the fertility declines not only in women but also in men. So just like in women, the fertility declines after 35 years of age. Similarly, in men, the fertility declines after 40 years of age. In both quantity and quality, the sperm count goes down. That is one thing. Other things what we ask you is about your intercourse, if there is any problem with the intercourse. So there can be any erection or ejaculation problems, and many a times these males do not come up forward for these of the problems. So these can be also the problem. The frequency of intercourse is also an important factor. Then comes, we also ask about the occupation, because many a times there can be occupational exposures which can also lead to the damage to the sperms. So these exposures we have to is important, and then the lifestyle is also an important. Personal habits like smoking and physical activities, alcohol consumption, any recreational drug use, and many a times over the counter drug use which might contain some steroids. These also are found to affect the sperm quantity as well as quality. So these are the series of questions which we generally ask to any of the couple, and always infertility is a problem not of a woman, of a couple. So we like to talk to both the partners, and it is always important to evaluate both the partners. So for the evaluation of the male, uh, for examination, what we do is to we need to take the weight of the and height of the male partner, so that we can have the weight height ratio, because this weight height ratio, if it is higher than the normal, this can have also a grave impact on the sperm quality. So these things what we do on for investigations, mostly we rely for the male fertility to act to find out any problem with the male fertility. So we rely on the semen analysis, for which I told you that we have we look for the number, we look for the movement, and we look for the shape. So now coming to this way we evaluate to find out what can be the cause. So initially these are the part of our conversation or consultation, in which we can get an idea of what can be the cause. So like sperm production, and the problems with the sperm production. So the problems with the sperm production can be because of the either genetic causes. So there are some genetic disorders which can be there. So for this we do some genetic testings. So what are the genetic disorders? Actually, when any human being is born, when any baby is formed, they contain half of the genetic material from mother and half from the father. So if there is any problem in the genetic material, so that will be carried to the child, and the male partner can have carried some material, some problems from their family. So that's why we need to have a proper family history also. Sometimes these genetic conditions can arise de novo. That means in the person on that they do not may not have a family history, but when we do genetic testing, we may find some of the problems. So these are the genetic diseases. Many times infections, especially we ask about the some childhood infections like childhood mumps infection. So this childhood mumps infection has a grave impact on the sperm producing ability of the testis. So if there is a personal history of mumps infection, that can also have impact. But thankfully, because of vaccination, this infection has also gone down. Now, if there, we also need to know the history. Like sometimes we are asked about, have you ever undergone any surgeries in the childhood? So if there is any history of undescended testis, that means the testis was in abdomen and after birth it was surgically moved out. So many a times, however early the surgery is done in the childhood, but then also sometimes there's some damage happens because testis is outside the abdominal cavity in the scrotum, which makes the temperature of that region are 2 degree less than the normal body temperature. So when it is that is the proper environment which is needed for the sperms to form. So the damage can happen if the testis is inside the abdomen. So that damage can happen. So this is one of the reasons for in problems if there was undescended testis in childhood. Then there are some conditions like some which is there can be testicular torsion, which is more common in the teenage and young people, which are more who are more athletic or more sports person. Sometimes it can happen. So generally, the torsion of the testis is a very emergency condition. They may have severe pain at that time, and they might need surgical intervention, because when the testis twists itself, the blood supply cuts off. So that can be grief for the testis, and that can lead to damage of that testis. So that can be one of the reasons. And another is like heat exposure. So just I told ki, that 2 degrees less in temperature is required for the proper sperm production. So if there is heat exposure because of any reason, like this, because nowadays people are to work from home, more and more laptops are being used, so that produces heat. So if you are using it on lap, so that produces heat, and that heat is generated, which it can be, which increases the temperature of the testis. This can be detrimental. Also hot sauna baths, and these are hot baths, these are also giving you more of the exposures. Also some people have occupations like working in the bakery or mines. These all have the hot exposure, so this can also have the effect on the sperm production. Another problem is varicocele of the varicoceles can be there. So what is varicocele? Varicocele is basically when the veins above the testis becomes dilated. It is called varicocele. So when they become dilated, increases the temperature of the testis, and that also has detrimental effect on the sperm production, and then the sperm quantity, sperm quality, everything goes down. Now coming to sperm transport problems. So what are the transport problems? So sperm transport problems can be, that is, the sperm is getting produced, it is normally getting produced, but it is not getting transported. So the tube, either the tube is missing, which is can occur in some of the genetic conditions, or there are, because of some infections, there are some blockage. And particularly this is, the infection can happen with this, there are some sexually transmitted infections, and if the infections especially are left untreated, so these can cause to the blockage of the tract. Or sometimes if you have undergone the surgery to remove the part of the tube as a part of this sterilization procedure, that can also lead to the problems. So these are some of the problems which can prevent the transport of the sperms. Now coming to the, yes, some of the there can be some hormonal problems. Excuse me. So there can be some of the hormonal problems, like the sperm production happens in testes in the presence of the hormones which are secreted from the brain. So the brain secretes the hormones FSH, LH, and in response to that, the sperms are produced in the testes, and also the hormone testosterone is produced. So if there is anything which affects this, so either there is problem in the brain where, or there is radiotherapy to the treatment of anything. So if there is affected, so FSH, LH hormone production will be less. Or if anyone is taking any hormones or steroids for improving athletic performance, it may improve the athletic performance, but it interferes with the hormones which help in the sperm production. So these all can be affected. Another thing, taking testosterone. Testosterone is secreted from the testis when the sperms are also produced, but taking testosterone from outside can also impair the hormonal influence from the brain, which causes the sperm production. So this is how it affects some of the people on. So we have discussed with the sperm production problems, we have discussed with the some transport problems, and there are the hormonal problems. But some people can also can have everything be normal, but they can have sexual problems like erection and ejaculation problems. So for those, these are can be either psychological, they can be either organic, maybe they can have some problems. So mostly there can sometimes they have, if the partner is having male partner is having high blood pressure or diabetes, or they are taking some medications, these can also have problem interfere with these. So if there is if we have any patients with these problems, we need to counsel, we need to explore the causes. If there is any medical problems are associated, the correct treatment of them, and if there is any medicines associated, then we need to change the medicines. So these can help the male partner. And also counseling plays a very important role to understand. So, and then they may need further examination, for which we generally refer them to the andrologist. Andrologists are the specialized doctors which who deal with the male fertility. So we then refer them to them so that they can examine you and they can do other tests which required, and then they can provide the proper treatment accordingly. So this is how we can get to know about the causes of the male infertility. So whenever any problem we find in semen analysis report, and which can be either because of the problems with the sperm production or because of the sperm transport problems. So whenever there is some abnormalities of this semen analysis, if the abnormality is too big abnormality, that count is very less, then mostly we do for next forward going forward, we check for the hormonal test. So what hormones do we check? There are the hormones which are follicle FSH and LH. These are the two terms. These are the two hormones which are secreted from the brain, which affect on the testes and cause the sperm production. So they are mostly involved. So to look for evaluate further, your doctor may advise you to do hormonal tests, which includes for your FSH hormone, LH hormone, and testosterone. Sometimes we might need to evaluate other hormones like thyroid and prolactin. So these are some of the hormones which we are testing. So hormone test results combined with the results from the semen analysis helps us to have an idea about the cause of the male infertility. So once we have all these results, when we get to some cause, then we can go forward with the treatment. So how we can treat? So treatment is mostly, if we are able to find a cause, it is cause specific. Like if there is any genetic problems, we cannot do with the if genetic problems, then we see if how grave is the genetic problem and is it affecting each and every cells, then we have to decide accordingly. So if the sperm production problems are like sperm, many times we find the count is normal, but the motility, ability to move forward, or the morphology is abnormal. So if the count is coming to be normal, that means production is normal, but after production there is some damage is happening. So it might be because of the environmental exposures or because of some other problems which is happening afterwards. So these can, at this place, lifestyle factors plays an important, very important role, because it has been seen, if you change your lifestyle, if you improve your lifestyle, if you have maintained a healthy weight height ratio, if you are being more physically active, and if you are having exposure of any exposed occupational exposure of any chemicals or any exposure of the hot environment, if you bring about these changes, these might improve. But the improvement takes time. So it needs a patience on the part of the male partner, because these take time, because sperm production takes around 70 days for a sperms to produce. So the when we are bringing about these lifestyle changes, so the sperm production will slowly will change, and that whatever changes we are expecting, it will take a little bit of the time. So now coming to hormone treatments, like if there is no sperm or very low sperm count is there, and there is not even the count is low, the movements are also the small, whatever sperms are there, their movement, forward moving capacity, or their capacity to or how they look, their shape is not very normal. So in that conditions, we generally do a hormone test, and after according to the hormone result, we decide the treatment. So if we find that say the count is very less, and there is FSH LH hormones are coming to be normal, so in that condition, it might be that there is some damage to the testes and the sperms are getting production is has come down. But if the hormones like FSH and LH hormones are less, and the count and everything are low, that means the information, the message from the brain is low, the hormones are low, FSH and LH. In that condition, it's very important to rule out any genetic causes. And if we, and also the over the counter drugs, especially the steroids, and if these are ruled out, then only then we can give you treatments with the hormones, we can give you the hormonal injections, but it is given by the specialized doctors only. Do not, please do not take it yourself. So that can be given, and the production can be regenerated, it can be restarted. So this is one thing which can happen. And on another is like, if there is no sperm, and we find that FSH-LH is also normal and testosterone is also normal, that means the production is happening, but it is not being able to carry it out. That is called the problem with the transport. There is no transportation. So for that, what solution we have is that we can retrieve surgically, we can take it out surgically using one needle, we can take it out, and that can be further used to make your partner pregnant. So and how we can use it, I will just discuss it in a moment. So that is one way we can do. Even if we find that and when we find that there is no sperm or very low count is there, and FSH LH is very high, the hormones are very high. That means the brain is giving the message. In fact, brain is giving more message. Why? It is because the testis is there, but work is not. It's not working properly. The testis is little bit damaged, and the sperms are production is not very good. That's why the brain is making giving more messages so that they start working, but it's failing. So there might be some testicular failure is happening or damage is happening. So in that conditions also, if there is some, if there is depending upon the count, how much is the count, if there is no count, we are unable to find a single sperm, then again we can do biopsy and try to remove the sperms. And if we find some sperms, we can store that sperms, we can freeze that sperms, and we can use it further for IVF to make your partner pregnant. So like, even if there is damaged, but sometimes at some places we can find some of the sperm production happening, so that can be utilized. But if there is the problem is so much that if we are unable to find a single sperm, then the comes even after the biopsy, even after trying to see from multiple sites, if we are not finding any sperm, then the scenario totally changes. So if we are unable to find a single sperm, then we cannot do even the IVF, or what we call test tube pregnancy. In that condition, the options goes for, like, you can have the option of either donor sperms can be used, which can be either injected in your partner's egg, which is by IVF, or donor sperms can be washed and can be injected inside the uterus of the female partner, which is called donor insemination. So these are the options for those couples. And if we are able to find some sperms that can be used, so since we are taking through injections, these sperms, these are in very less quantity. So since these are in very less quantity, we cannot inject these sperms directly inside the womb to make wife pregnant. That in that condition, there is another thing which is mostly this type of ART, or artificial reproductive techniques, in which these, since they are less in number, we have to inject these sperms into each and every eggs to fertilize the eggs. So this is done in the lab under proper environment and by the specialized embryologists. They are called the specialized trained persons. They are doing. So they will do, and when the embryo is formed, it is transferred inside your partner's uterus. So this is how we can solve the problem of having very low, either there is very low quantity or very low quality of the sperms are formed, and in that condition, or in the condition when there is no sperm, but luckily we have been able to get some sperms by doing the surgery, by doing injection, by taking out through injections. So these are the options. So, and if anyone do not want to go for IVF, because whenever the IVF is involved, it is not involved only the male partner, it involves female partners also, because for IVF the eggs has to be taken out from the females. The female has to be given multiple injections so that she produces multiple eggs, and eggs has to be taken out, and that has to be used in the lab. So this is how it works. So now coming, what is IUI and where does the picture of IUI comes? So when there is sperm quality and quantity are little less, but not very much less. In that condition, the sperms can be used, it can be washed, and it can be injected inside the womb or uterus of your female partner. This is called intrauterine insemination. So this is how IUI works. But for IUI also, the sperm, some quantity and some good quality of sperms are needed, and since it is just injected inside the uterus, so the sperms have to move from the uterus to the tubes by themselves. So some good quality of the sperms are definitely needed for IUI also to work. So this is how in basics we treat for male for infertility. And so we each has to be treated, and there sometimes we have to involve other specialities, like we might need to involve andrologist, we might need to involve some others. If you are having any other medical, if the male partner is having other medical conditions, the physicians like might we need to involve. So this is how we treat male infertility cases. So if there is any question, I would like to happily answer that. And I have some questions in some of the common questions which I have got from some of the patients, which I would like to discuss. So, does age have any effect on male fertility, and how does it affect male fertility? I have discussed this. The male fertility declines after the age of 40, with the and the number and quality declines. And with the age, even if the number is okay there and quality, it seems to be okay on just microscopic examination by looking the movement, by looking the shape. But there might be some DNA damage, which can also lead to the infertility, or sometimes, if pregnancy happens, can lead to recurrent miscarriages also. The now next question are what causes and treatment needs to be done to find out why there is no sperm in ejaculate. Okay, so I think I have discussed this. The test and treatments, if there is no sperms, we will do FSH and LH hormones, and also the testosterone hormones are done. And after these tests, we need to, with these results, so that if FSH and LH is low, that means the message from the brain is low, then we have to look for genetic causes. If there is no genetic causes, we can give the injections of the hormones to these couples and the male partner, and the sperm production may start. If there is any blockage, we can either go for the surgery to treat the blockage, or we can take out the sperms through injections through the surgical procedure. The sperms are taken out if the sperms are good in quality, and then we can use it further for IVF. And if there is no production, even if we are taking out from the injections, then in that condition, the adoption or donor insemination is an option. And what if no cause is found? So I have discussed various causes. So suppose if there is no cause is found, so if we are not able to find any cause in the males, like if there is no cause in the male and female both, which is called an unexplained infertility. In these cases also, many a times we have been able to explore, the humans have been able to explore multiple causes, but still many things remains unexplored. So we do not know at what level what cause is there, but it has been found that if in unexplained infertility cases, if many a times IVF, ART, that is artificial reproductive techniques, which includes IVF and ICSI, intracytoplasmic sperm injections, these have been successful. So that is one of the options which you can try after you have been trying for at least 2 years with no problem being found, and you have tried all other methods. So this answers this question. Next is how is male infertility treated? I have discussed this. As per the cause, we'll treat according to the cause. We need to have during the consultation, we'll take out the history. We'll try to find out in that any cause is there, and if then we investigate, we do a set of investigations to find. Sometimes in the males, we might need to send to the andrologist so that they can examine you and they can see from their prospects. Sometimes ultrasound scan of the scrotum is also done to find out if there is any varicocele, or if there is any if what is the volume of the testis, if there is any problem there. So that is also done, and accordingly we have to do. Along with that, I will always say that lifestyle changes matters. Along with that, lifestyle changes also matters. So that also you need to do. Sometimes your doctor may advise some treatment, some antioxidants. So these might have effect, not very much proven, and it will be little slow, but it might have effect. Next question is, how does varicocele affect fertility? So, first of all, varicocele. What is varicocele? So, when the veins above the testis becomes dilated and become tortuous, and more of the bloods are getting accumulated. So it is called varicocele. In that condition, the mm, temperature increases, and that's why the sperms which are being after production, which are being accumulating and staying there before they're getting transported, they have these effects on them and they get damaged. So that's how this varicocele affects it. It can affect the quantity and quality of the sperms both. And coming to the treatment effect on the treatment, so if there is the varicocele is of high grade, so many a times it has been seen that with if the high grade varicocele are to be treated surgically, if they have been treated surgically, many a times it has been seen that high grade varicoceles after treatment respond very well to the treatment and the quantity and quality may improve. Coming to next question is, how sexual problems treated? It basically depends upon the cause. Many a times we have the cause, and if we find the cause, the treatment of the cause treats the problem. Another thing is like andrologist. We many a times we send to the andrologist because they are the basically the male for reproductive tracts specialists. They can see from their point of view, and counseling definitely matters. Now, when should a man think about storing sperm? Yeah, it's an important question. So, storing sperm. So, mostly by medical recommendations, we can see, if we see that if any person has been found with any cancer and is going for any radiotherapy and chemotherapy, which can cause problem, which can affect the fertility or the sperm production later on. So before starting the those treatments, the male can store the sperms, which can be used later on to achieve pregnancy in the wife or female. And also some of the chronic diseases are there for which medications are given, and some of these medications can be toxic for the sperm formation. So even these are being anything is being planned like that, so in that condition a man can think about storing sperms. Okay, another question is, can I do anything to prevent male fertility? So, mostly what you can do is to bring about your lifestyle changes, like avoid cigarette smoking, alcohol consumption, and also if avoid follow the occupational standard guidelines, avoid exposure to heat, be physically active, maintain a healthy weight height ratio. These are the important things which you can do. Also, some of the occupations have some effect, like pesticides. Those who are using pesticides, those who are have exposure to the chemicals, those who are having some hot environment. So these are the effects also. And also to those who are safe sex practices also affects, because if there is any sexually transmitted infection, so that should be treated promptly, because that can also have effect on the fertility. So these has to be taken care of. And now, what is ART? So, ART is assisted reproductive techniques, which includes IVF, which is in vitro fertilization. That means fertilization is happening in vitro outside the body. And another is also which is involved is ICSI, which is intracytoplasmic sperm injection, in which the sperms are injected inside the egg. So it is done under the microscope. Suppose this is an egg, the sperms are injected inside. So this is done with specific instruments by specialized persons. So this is ICSI. So these are I have already discussed about what are the indications when we do these things. Okay, this is one interesting question. Are birth defects more common in children born after ART? So, see, researchers have found that there are some higher rates of birth defects in babies born after IVF or ICSI. But IVF or ICSI in per se itself is not the cause of birth defects. Mostly when we are doing IVF or ICSI, we are actually bypassing the natural selection method given by the nature. So we all know for natural pregnancy to happen, millions of sperms travel up in the female reproductive tract, and only one sperm fertilizes the egg. So that is the natural selection. when only one sperm out of the million, which is the best one, is able to fertilize, that is the best sperms. But when we are doing ART, or in which IVF or ICSI, when we have limited numbers of the sperms, there are, although already there might be some problems which we are not able to decide, or which we are not able to find out. So there are already some of the problems which has led to the infertility. These can cause the birth defect. So per se, the treatment doesn't cause, but there are some inherent things which are there, and which, since we are bypassing the nature, we are not able to find which is one is the best to select. So that is one of the causes. So I think I very much have answered your query. And what is donor insemination? I discussed. So when there is absolutely no sperms we find in the male, and even if after biopsy we have not found any sperms, and then if we if then also if the couple wants biological same child, they do not are not willing for adoption. So in that conditions, they may want to go ahead with the donor insemination, in which the sperms or semen is donated by some other person who is generally anonymous. And these anonymous person generally go through rigorous investigations, and all the blood tests and all the genetic factors, many things are checked for them. So after rigorous screening only, they are selected and the sperms are then used. And that will be, many things are matched, like the blood group and many things, criteria are matched when we are giving donor insemination. So this is what called donor insemination, when the insemination is done using the sperms or semen and donated by anonymous donors. So, and many a times when the people do not want to go ahead with the IVF or ICSI, even if we find the sperms after the biopsy or after the injection, then also then that is an option for them. What is ICSI? I have already discussed what is ICSI, and now the last question: what are the emotional issues in male with infertility? So, see, from my first sentence, what I told, that it's common to think till now that the infertility is a woman's problem. So, when the problem comes in the male, and when it is discovered like it is a male infertility, it comes as a shock to many men, and many men find it very difficult and to cope with this situation. And they are, many times they are shaken by this idea of how they cannot have the pregnancy of their own. So this comes in many ways and many types and many forms. So it's very important to be with your partner when at the time of need, and also counseling helps a lot. And we have the treatment and everything which can be done, we have to move forward. So emotional aspects do play in the male infertility. Emotional issues do need to be handled. It has to be handled with care. So this is how I will say about male infertility and how we treat and about this. So I think there is no question, no more questions, so I will end the session. Thank you all.